Some breaking news coming in, an advisory on the testing strategy that needs to be followed now by those individuals who are COVID positive and their caregivers. This has been declared by the ICMR, the Indian Council for Medical Research, and seems to suggest that those individuals who are direct contacts of COVID positive individuals do not need to be tested themselves for COVID unless they have comorbidities. So if they are healthy individuals, as I understand it, they don't need to be tested. And that raises lots of questions about whether individuals who are direct contacts of those who have fallen unwell may be actually traveling outside with the potential of infecting others. Let's go across now to Akshay Dogre for more on this. What exactly is this ICMR guideline?
Well, Vishnu, this guideline is by ICMR now under the changing methods and the changing scenario as far as the transmission of this particular variant is concerned. A lot of guidelines are being changed. So earlier, while it was the isolation period, now it is on the testing. So we also heard there was in a central government hospital, Lady Harding Medical College, the hospital had said that all the frontline workers, all the doctors and nurses, other healthcare workers who come in direct contact, no matter the degree of contact, if they come in contact with a positive patient of COVID-19, and if they do not exhibit any symptoms of COVID-19, that they do not need to get tested, they have to look out for any symptoms, and if they appear...
The guidelines as I read this particular report, because it really needs to be looked at closely. This ICMR document, which has been released, says people who need not be tested, asymptomatic individuals in community settings, okay? If they're asymptomatic and they have absolutely no idea that they have COVID, chances are that they would not be doing a test in any case. So that point is a bit strange. The second one, contacts of confirmed cases of COVID-19 unless identified as high risk based on age or comorbidities. This seems rather strange because given the transmissibility of Omicron, if you are a direct contact of somebody who is a confirmed case, why would you not want to test to see whether you are sick or you're not sick? Because in a community context, and in the context of how people in our country live, in very close proximity to each other, why would you not want to test? And the danger therefore is if you do not test and you are infected and turn out to be asymptomatic or even symptomatic, based on these guidelines, if you were to step outside, is there no possibility then that you would end up infecting others? In other words, spreading this infection to many others. Thirdly, patients who stand discharged as per home isolation guidelines, I believe that's a week, right? I believe that's a week. You don't need to test. So how do you know that you're actually okay and that the disease doesn't linger? Number 4, patients being discharged from a COVID-19 facility as per the revised discharge policy don't need to test. Individuals undertaking interstate domestic travel don't need to test. So then how do you prevent the spread if you aren't testing? Because testing is the backbone of the entire policy and the entire system of dealing with COVID. How can you not test? Now, a few more details over here. Who may be tested? All right. So these are the individuals who do need to be tested. In a community setting, right? That's essentially places where we live. All of us live in colonies or in the proximity of other people. That's a community. So these people need to be tested. People who are symptomatic, who have cough, fever, sore throat, loss of taste or smell, breathlessness, and or other respiratory symptoms, they need to be tested. Now, this is not inclusive of all the symptoms of COVID. For example, a stomach upset is also a symptom of COVID, which often results in some of the other conditions happening later on. That's not been mentioned over here. Number 2, at-risk contacts of laboratory confirmed cases. All right. However, if you feel that contradicts what I said earlier, here's what this detail is. At-risk contacts are elderly, in other words, more than 60 years of age, and individuals with comorbidity, such as diabetes, hypertension, chronic lung, or kidney disease, malignancy and obesity, these are individuals who must be tested. But elsewhere, as I told you, those individuals who don't have these comorbidities or who aren't senior citizens and yet who are direct contacts do not need to test. That seems bizarre. Number 3, individuals undertaking international travel, they do need to test, all right? As per country-specific requirements, that remains the same. Number 4, international travelers arriving at Indian airports, seaports and ports of entry as per laid down guidelines do need to test. So these are a couple of conditions over here which really needs further clarifications. Why would you want to cut down on testing when India needs to know how many cases we actually do have?